Go.
Hello, my name is Abigail Santos. I am from classroom nurse 443. My presentation will be about article critique about a topic on skin prevention interventions for the elderly population. I had chosen this topic because I work closely with the elderly patients and see multiple skin complications that are due to the fact of extrinsic factors such as prolonged sitting, lack of turning positioning, and lack of early nursing prevention. In my facility, we have come up with various nursing preventions to prevent pressure ulcers and skin breakdown that is catered to the patient. The first article I have chosen to critique is a quantitative article found in the Journal of Clinical Nursing. The article is called Exploring the Relationship Between Skin Property Absorbent Pad Environments. Absorbent paddings I have seen firsthand be worn by our residents, but I never knew what it is the action of these paddings. And this article helped me understand further how it could help and how it could hurt the resident. The aim of this research is to identify the related factors that cause skin lesions which could cause skin breakdown. The intention of absorbent paddings are to be worn as protective gear against feces and urine, which could be in the absorbent paddings for a long time. The clinical significance of the usage of exporting absorbent paddings in the environment can either help prevent skin breakdown or create more skin complications. The purpose of the study was to test absorbent pads that could promote skin friction. Absorbent pads increase with skin wetness and that can cause patients more susceptible to skin damage. However, long usage of absorbent pads on an older incontinent patient, such as the patients I work with, will have prone to weak skin turgor and weak skin elasticity, which will cause them to have the development of skin lesions. The researcher in this study tested absorbent paddings used by older incontinent patients and was worn by them throughout the study. The study was divided into two groups. 100 patients were chosen, 50 male participants and 50 female participants. The groups that were divided were called dual incontinent groups, which participants had both urine and feces, and the second group was called fecal incontinent group, which participants only had fecal exposure. Participants with serious medical problems or who were acutely ill or only had urine incontinence were removed from the study. Participants who had an indwelling Foley catheter was placed under the fecal incontinent group. The size of the absorbent paddings was based on the amount of urine secreted by the participants. 3 different sizes were used as well. The researcher had chosen to do the same implementation on gathering data for this study. The schedule of data collection was done every morning at 9 o'clock The same skin regimen was conducted to collect urine and feces. The skin regimen consisted of washing the areas of the participants with enclosed products with soap and water once a day. The amount of urine was measured by the weight of soil absorbent pads, and the amount of wee weight was determined by the absorbent paper filter that was absorbed in the paddings. The findings of this research had indicated that 36% of the participants had developed skin lesions, and of that, 32% were males and 40% were females. Contact dermatitis had occurred 17% of the study, which was commonly found as the most skin lesions compared to pressure ulcer, which occurred 6%, and 6% had seborrheic dermatitis. Contact dermatitis was commonly found in the participants' perineal areas. The researcher indicated that there is a clinical significance of the data between male and female findings, but did not indicate how so in the study. Also, there is no clinical significance mentioned by the researcher about the patient's characteristics on how they develop contact dermatitis or seborrheic dermatitis. The incidence of participants who developed pressure ulcers was mentioned by the researchers who had stayed in the wheelchair or who had lack of repositioning for periods of time. The study had concluded that there was a high prevalence of skin lesions with older continent participants because of them developing contact dermatitis, which accounted for the majority of their skin lesions. Contact dermatitis had occurred from the spread of feces that was absorbed in the wet areas in the absorbent pads. Also, the study concluded that early implementation of skin breakdown needed to be enforced by all healthcare professions. Cleaner way of doing incontinent care was also suggested by the researcher, so spread of feces will not develop into contact dermatitis. The second article I have chosen for my topic of elderly skin breakdown and early prevention is an article that could be found in the British Journal of Nursing. The article is called Introducing a New Skin Regimen for the Incontinent Person. The purpose of the article was to emphasize the importance of implementation of skincare as part of fundamental skin regimen nursing, such as early implementation as the main focus of basic nursing care to incontinent patients. The article discussed the management of incontinent care can be a sensitive cultural and socially prohibited topic to discuss, and is often overlooked or disclosed because it discusses an individual's urine and fecal components. The article had indicated in the United Kingdom there are protocols recommended for skin care products which had emphasized to be the fundamental basis of nursing care. The article had mentioned that the importance of cleansing a participant with soap and water is the best way to prevent development of infections. Infections due to urine and fecal components causes the patient to develop any skin damage that could be easily prevented if found early in the patient. The article study had a panel of 11 nurses, pharmacists, and other healthcare professions to determine the criteria of the study of topical skin interventions to prevent pressure ulcers. The results of the study had indicated that topical interventions were effective, and the researcher of this article had another study which investigated the setting in an elderly care facility that used 3 different skincare regimens. Those skincare regimens consisted of soap and water, Elomet foam, and combined cleanser and barrier cream. The results of the study had shown that 71% had no change in skin condition, which had used the skin regimen of cleanser and barrier cream group, whereas 30% that used Elomet foam had shown no sign of change. Lastly, 47% of the participants of the study showed signs of improvement in skin. Data collection from the study was based on the responses from nurses and patients and how it had changed the skin of the patients and how the nurses had seen changes from their nursing care. The researcher of this article had conducted his own study that helped his hypothesis of how the Elomet foam could provide a cost-effective method to prevent skin breakdown and pressure ulcer development while conducting safety infection control. Elomet foam was a cost-effective method and was used to prevent and control MSRA, which is mostly found or commonly found in incontinent patients due to the fact of contact precautions. The researcher also had indicated that this type of topical cream improved patient care and the care of the nursing staff. The data was collected over a 6-week period and had patients aged from 70 to 100 years old, but gender was not specified. Patients were usually picked from both incontinent of urine and bowels. After reading this article, I have seen that the researcher had mentioned many interventions from previous experience how Elomet foam could be emphasized as cost-effective and reduce hospital stay of patients. I hope this presentation will teach others about how skin prevention in the elderly could be done successfully if thorough physical assessment and the teamwork of nursing care is implemented when the patient is admitted. Thank you very much for listening and watching my presentation.